I'm Crystal Spring, and I'm a public health dental hygienist. I love my job. The work that I do has changed the way not only I live my life, but how I look at the world. We're in the middle of a pandemic, and during this time, my love for public health has given me hope. In the middle of a pandemic, I'm thinking that, wow, I know there's a pandemic going on, but this is an opportunity. This is an opportunity for us to improve oral health disparities in our country. People are finally looking at their neighbor's health and knowing that their neighbor's health matters to them. It should matter to them. Your neighbor's health affects your health. If your neighbor doesn't have access to care, they can't be seen for preventative services. Your neighbor is going to be unhealthy, and that is going to cause you to be unhealthy. So during this horrible time, public health has given me hope that people's eyes will be open to access to care and some of our disparities. During the pandemic, we learned that dental is essential, that preventive dental services are essential, and now I want us to prove that preventive dental services are essential to everyone. Not just those who can afford them, but to everyone. I want to share a little bit of my story. I grew up in a really rural area. I grew up in the northeastern corner of Montana, really close to North Dakota and Canada, on the Fort Peck Indian Reservation. And to say that we had an access to care problem is a drastic understatement. Myself, I would have to travel over 70 miles to see a dentist. We did not see the dentist for preventative services. We only went to the dentist if we were in pain. The only preventative services that I received growing up were from programs that would come into our school. Let's fast forward. I've been wanting to say 20 years for a long time, but it's way more than 20 years. I'm like, fast forward 20 years. Well, let's fast forward a few more years past that. And I'm working in clinical. I'm working in a practice that I love with a dentist who is amazing and a team that this is my forever job. I'm working maybe 1 to 2 days a month at a nursing facility, so I'm getting my public health. I think I'm fine. And little did I know, I am scrolling through Facebook one night and I see that my cousin, it's my first cousin, is waiting in line. She has a post on Facebook that says, "I've been here all day waiting to see a dental hygienist. I don't think I'm going to be seen today." And this just sparked this thing in me. I knew that I had to do something about this, not just because it was my cousin, but it was my hometown. So I spent the day making calls, and by the end of the week, it was maybe the next Monday, I was driving the 460 miles to my hometown. I was leaving my husband, my kids, my job, and my home to go and wet my feet in public health, working in a school-based tribal program. I remember that it was only within a couple hours that I started to get this anxiety. I knew that I had to call my husband on my lunch hour. I knew that I had to call him, and I needed to tell him something. I needed to tell him, I'm coming back up here. I'll be up here once a month for the rest of my life. And his reaction, because I've got a good one, he knows my heart, he knows that I needed this, and he was so great about it. I worked for that program, leaving my home and traveling up to the reservation once a month for about 5 years, and within that time, I just couldn't keep it to myself. I shared it with my friends, and there was another hygienist that had come to work with us, and we would talk about the amazing work we were doing, how good we felt about the services we were able to provide, and that led us to start our own nonprofit, Smiles Across Montana. We started out with 2 hygienists, bringing services to nursing homes and Head Starts. And now we're at 10 hygienists working for us, almost full-time, and 5 dentists. We're now in schools, nursing facilities. We did a migrant clinic the other day. it's gone crazy. I want to talk to you about mobile and public health. I think that there's a lot of confusion of why people are working in public health or that it's substandard. Public health is only as substandard as the provider providing that care. If you haven't seen mobile equipment lately, you need to take a look. You need to see what's out there. What we bring in, even when we're more portable, the equipment that we use, it's top-notch. The services that we're able to provide, I'm not missing anything in my mobile clinic for preventative services that I would have had in private practice. That's really important to us. So I wanted everyone to know that public health is not substandard care, because that is something that really hurts my heart, and I want people to not think that they would have to leave their standard of care to join us in public health. Public health is also, you need to be up on the latest innovations. You need to be aware of what's going on in the dental world. You need to know about products that are going to change oral health disparities. Some of the things that have been great for us is glass ionomer sealants. I don't know if any of you use them. You can raise your hand. I might see you, I might not. It's pretty bright in here. But glass ionomer sealants have made it so we can actually do sealants on a much younger child. We're not having to wait till they already have a cavity. We're able to use some of these preventative measures to keep young children from getting cavities. And I don't want to call it magic sauce. I was like, don't say magic sauce up there, but our magic sauce, the biggest game changer in public health, is silver diamine fluoride. When you're a dental hygienist working out on your own and you see a student come in time after time, you see it as a small cavity. Next time you bring him back in, it's a little bit bigger. And then it's bigger and bigger, and there's nothing you can do. SDF has changed that. So I just have to do a big shout out. If you don't know enough about SDF, you can come talk to me. There's crazy SDF people everywhere. And then, again, something else with public health that is really important to remember is we are educators. We're educating our patients to take ownership in their own health. They will own their own health. Students are smarter than we think. They pick up on things that you give them control of. Something that has been really important to me, and a message that I just want to share with others, when we have someone come in and I see plaque all over their mouth, I don't say, how many times are you brushing a day? I don't shame them. I'll probably whisper in their ear, hey, do you have a toothbrush? There's a lot that we're not thinking about when we're in private practice, and I love private practice, but I'm just want to share my passion for public health and what we're seeing and the need for public health. I also wanted to say that if you're not a fan of public health, if it's just not your thing, I urge you to look at the numbers. I ask you to look at the oral health disparities that we have in our country at this time. How many people are going without? And if you can see that, and you can see what we're doing to change these oral health disparities, and you still don't like public health, you still don't like what we're doing, I just ask you, just don't stand in our way.